Baker Mayfield, not close was his answer. Which guy 8 years from now, looking back, has had the best run?
Really interesting response. Totally not who I would have thought he would have said.
615-737-1045 if you heard something in there that you want to respond to. Also, NFL win totals, the first release in the world from betonline.ag. Where are the Titans? Where is the rest of the AFC South? Some other teams. We'll go through that when we return. Sport Ortho Urgent Care. One phone number, the Sport Ortho hotline, 615-553-5000. Dr. Kalen with us to talk about returning to sport, the rate after ACL surgery. Doc.
I think, Brent, when you're talking about drafting and who to pick and when, the key, of course, is who do you got to play and how long will they help your team. And there's such a high percent of ACL tears. One of the big things is how soon can you come back, and if do people come back after ACL. So, when patients suffer an injury, there are three things that they deserve to know: the diagnosis, what's wrong with them; a treatment plan, what are you going to do about it; and a prognosis, when am I going to get back over this? So when it comes to an ACL injury, there's significant variability among surgeons. And an article published this week, they found a very low return to play in sports if you had suffered a concomitant injury, like you had torn your MCL or had a meniscus tear. When I was in Birmingham in the 80s, I did a study for Dr. Andrews where we looked at 469 ACL tears in Division I and pro players, and 65% of those had an additional cartilage injury, which, of course, puts you in the bad prognosis, and that's why the information for the draft is so important. In the American Journal of Sports Medicine, they do show a 17% re-tear rate in the latest American Academy of Sports Medicine meeting, but that also tells you 80% were able to play. So the key, of course, is rehabilitation. Also, we were in Birmingham. Also, I'll tell you, we used to go upstairs twice a week to physical therapy, and Dr. Andrews, Dr. Lemack would examine the players. And, if you had a cornerback light, he might adjust their therapy and push them slower. And, if you were a 300-pound nose guard like me, you would slow them down. But the bottom line is do not rush back to sports. An extra 3 to 6 months of rehab just might keep you from starting over with another surgery. So patience here really is a virtue. Thanks, guys.
Thank you, Doc. Mount Juliet, Murfreesboro, downtown Nashville on 12th Avenue, Hendersonville, Cookeville on the Plateau, Knoxville out east. Sport Ortho locations. The phone number 615-553-5000.